You are listening to Dubai Eye 103.8. I'm Helen Farmer. You're listening to Eye on Health, brought to you by Arab Health and MedLab Middle East. And we are talking about sustainable labs, the labs of the future, why we as patients and the general population should care, but also the impact it's having within medical institutions. Now, according to the Paris Agreement, climate goals are needed to be attained by the year 2050 to be, well, a holistic approach is certainly needed when it comes to sustainability. One woman who's written about this is Carolyn Millward, Chief Financial Officer at Sheikh Shakhbout Medical City in Abu Dhabi. Carolyn, thank you so much for being with us today. And I think adding a really valuable perspective. We've been talking about, reusing materials in labs, about the importance of efficiency of, maintenance of equipment, but also some of the human habits that can add up to things not being so sustainable. Obviously, we've got the planet in mind, but the financial piece is a really interesting one. And I wanted to start by asking you about when we're thinking about the role that healthcare has, its carbon footprint, its impact on climate change. How achievable do you think that 2050 goal is?
Well, Helen, it's a great question, and I think that it's a big ask, but I remain optimistic. In the words of Nelson Mandela, he says, "It always seems impossible until it's done." And I think the UAE specifically has proven that anything is possible. But I think that the most important success factor will be collaborative global efforts. Without everybody focusing on this, it won't be achievable. We're going to need many innovations in energy efficiency, in technology innovations, and we're going to need to address the social determinants of health across the globe, because that will impact the ability of communities to adopt sustainable healthcare practices. And then lastly, just a focus on well-being and prevention in order to reduce the burden on medical services.
That is such an interesting point that I actually hadn't even thought about when we, looking at the amount of tests going on, the work that's been happening in those labs. Presumably, as you say, if, certain lifestyle factors are taken into consideration, if we're looking at, can I use that word again, that holistic well-being piece, um, you know, testing meds, the more we can stay out of that hospital environment, the better for us and the better for the environment as well, because we're not doing so much testing. So we've touched on it today, but for anyone that's just tuned in, Carolyn, what does sustainability mean within the context of laboratory operations? Would you mind just speaking to that point?
Yeah, I think as in healthcare in general, so also in the lab. In healthcare sustainability and in any sustainability, really, we need to keep in mind the minimizing of consumption, minimizing of waste, and minimizing of the energy usage. So in the lab, it's the same, but I think they have an opportunity in working collaboratively with physicians to reduce the unnecessary testing. They also need to look at their proper waste segregation so that they're increasing the recyclable waste and reducing landfill waste.
Mhm.
And then also working with the vendors to ensure that they are replacing the old, less energy efficient equipment. So working with vendors who are really promoting a circular economy so that we're investing in equipment that has a longer life cycle, that potentially can be repaired in modules instead of throwing away a whole piece of equipment and having to replace it all. So focusing on those areas, I think, and there are a lot of other areas, but I think it's the same across healthcare as it is for the lab.
What are some of the challenges to your mind when it comes to having a sustainable healthcare system as a whole, even outside of the lab? What are some of the attitudes or obstacles that, you're coming up against?
Yeah, I mean, there are many, many challenges when it comes to creating a sustainable healthcare system. You know, healthcare contributes approximately 5% of greenhouse gases worldwide, and that's more than the shipping and the aviation sector combined, which to me, when I first heard that statistic, was quite mind-blowing. So I think making all the stakeholders in healthcare understand the significance of this and why it has to be a top priority for every stakeholder, um, and changing the mindset of those stakeholders. I think that's going to be one of the main challenges, is how do we change mindset? And we've seen that already. And then there's increase in chronic diseases. And this again is about changing mindset because it's lifestyle based. And so how do we change the mindset of people to improve their own health, which then decreases the burden of healthcare? And, lastly, especially since COVID, we've really seen the increased pressure on costs in healthcare, and there's such a focus on reducing cost of healthcare. And so this is a huge challenge. Everybody's focused on reducing cost, but they're also having to now put that sustainability hat on. And there's a misconception that if you focus on sustainability, you're going to increase your costs. Actually, sustainability is about improving efficiency and reducing waste. And so that will actually bring down your costs in many areas, or you'll be able to redistribute what you're spending money on. So I think really looking at the long and short term effects of the increase in chronic diseases, and how do we want to address that, and then just jumping in and starting to work on something.
I think that's absolutely right. I mean, obviously, yes, that bottom line is very compelling when it comes to stakeholders, and perhaps there might be an initial outlay in technology or machinery that is more efficient, that has got longer life, but ultimately for the long term. But I also think it's a mindset when it comes to choosing to engage in this, to understand that, we all have a role. And in healthcare, unfortunately, we have seen things kind of moving quite slowly, even despite being a very technologically involved industry, because, lives are at stake. Patient care is always, and should be a priority. So it's not going to be a quick fix, but I think it's really important to think about there being opportunities as well. It's not just doom and gloom with climate change. People can get very bogged down of going, well, what role can I have? Or it's just one hospital, it's just, it's just one country. But there's huge amount of opportunity for, technology, innovation and strategy that, that you guys are implementing. What's actually happening at Sheikh Shakhbout Medical City that you'd like to highlight, the changes that you've made, Carolyn?
Thank you for asking. And I think there are so many opportunities, and people do think, well, I'm just one small hospital, or I'm just one person and I can't impact change. But I do believe that, if we can just influence one person one day at a time, then we're making progress and we're winning. At SSMC, we're really proud of the progress that we've made in 1 year. And we were recently recognized at COP28 by Abu Dhabi Department of Health for our impressive results in our green KPIs. The Emerald Moasure is a new rating that the DOH introduced this last year. And we were really proud to be recognized alongside 2 other large hospitals in Abu Dhabi for our results. And we started our journey just 1 year ago. And our first step was to make sure that we made this a strategic priority for the organization, with the support of the executive leadership, which is vital in any sustainability strategy or plan going forward. And one of the very first thing we did was set up a committee, which had myself as the co-chair and executive sponsor alongside our CEO. And we ensured that we had representation from each of our functional areas in the hospital. And this gave us insight into their departments, the expertise that they have. It created buy-in, and it gives us the ability to actually action on our initiatives. Is not just lip service. And then we had a bit of fun with that as well, because we were able to brand it. We branded it as SSMC Go Green Committee, with a tagline of providing sustainable care for a healthier planet. And this got people to buy in, and they love the tagline, they love the logo. So the employees really became invested in this strategy as well. And one of our significant partnerships is with Geneva Sustainability Center, who provided us with an SME, so subject matter experts, that helped to support our efforts. They provided great information about what we should be focusing on, which enabled us to prioritize our actions and start to set our strategy for the future. And one of the main areas that we worked together on was looking at education, awareness, and training, because we need to take our population with us. We need to take our employees with us. We need to take our patients with us, and we need to take the community with us. So we've worked on education. Our whole committee went through a masterclass. We've developed online training, which is now mandatory for all our staff, and we're going to be focusing on the supply chain next. One of the most impactful initiatives that we did in May 2023 was we actually banned the use of desflurane at SMC, and I think we were one of the first healthcare facilities to do this in Abu Dhabi. So desflurane is an anesthetic gas, and it's worse for the planet, one of the worst gases for the planet. So a 240 ml bottle of desflurane produces about 886 kilograms of carbon dioxide. And that's the equivalent to driving about 4,000 kilometers in a petrol-fueled car.
And how much
So
were you
you can
having
imagine
previous to
we were
May?
using about 140 bottles a year. So it was a great initiative. We were able to do it immediately, stop it immediately, working with the physicians and the anesthetists. And that was a very proud moment for us. And that will, we're continuing to look for opportunities like that. We've also discontinued plastic water bottles in our staff areas and replaced them with reusable bottles. We've replaced our plastic bags. We're working with our vendors on all our single-use plastics to slowly, well, not slowly, actually quite quickly, get rid of all single-use plastics. We've increased our waste management initiatives and recycling, and we've engaged a consultant to baseline our carbon footprint, which is really critical for us to set a proper strategy and science-based targets
to measure
going forward for the organization, so we can meet the 2050 goals.
Well, you're more than doing your bit there. That's really interesting to think about things that patients might notice and things that are happening behind the scenes. It is really fascinating. And obviously, it's only been a year now, and it's probably a bit too early to be thinking about those measurements, whether it is financial or terms planetary. But I think it speaks to the point you touched on earlier in terms of your Go Green, the naming of your committee is that the healthier world we live in, the healthier we are as people. And when we're feeling healthier, we feel more motivated and empowered to make changes. And it all starts kind of feeding into each other. What are your plans? I was going to say hopes, but I suspect it's going to be plans for the future. What's going to be happening there over the next, 1 to 10 years, Carolyn? What are you anticipating?
Yeah, so as I mentioned, we're doing our baselining of our carbon footprint now, and that will drive the priorities for us based on where we see the highest impact. So we want to focus on the highest impact items. We're already doing a lot of work on our utilities, electricity and water. Some of that needs capital investment. So as part of our budgeting process for 2024 and beyond, we have looked at that to make sure that we do have financial planning for those changes so that we can make them, because I said earlier that there's a perception that sustainability costs money. Well, it can cost money, and it does when there's capital investment involved in order to change buildings or to change consumption of utilities. But at the same time, if you have that long-term focus, you can plan for it and you can do it in stages. And you can also find savings in one area where you're getting the efficiencies to redirect that funding into the areas that require more investment. So we're hoping to do that. We'll continue with our education, and we're very focused on including the community. We want to do more community engagement events and just teaching our patients actually the importance of understanding their care and why they need to understand their care and what they need and what they don't need, and helping us to drive this change.
Well, it sounds like patients are in safe hands, both medically and environmentally, with you guys, Carolyn. Thank you so, so much. Lastly, for you to get your crystal ball out, are there any emerging technologies or trends that you're really excited to identify? I'm sure COP28 was an absolute, gold mine of ideas and innovations. Anything you anticipate could be in labs and indeed at SSMC in the coming years?
Yes, I think, automation and remote monitoring and reporting, digital labs, those will all help to create efficiencies in the lab, and lead to the financial sustainability of labs. I think AI is a buzzword at the moment, and we do at SSMC we do have an AI committee that's set up to look at different opportunities and vet them and make sure that they're in the interest of patient safety as well. And so I think AI is going to become more and more important in the realms of sustainability, not just financial, but also environmental. And I think the other sort of emerging trend is the precision medicine or the personalized medicine trend. And I think this is going to impact future research and funding priorities. So that will need to be considered as well. And it will really impact lab and the utilization of lab services, because with the personalized medicine, the test being done will be specific for that person and hopefully reduce the unnecessary testing that is needed to get to a result.
It's interesting, isn't it? We're so lucky here in the UAE with such incredible medical facilities and health insurance, but there are suggestions about over testing and we'll chuck that in as well while you're going to the lab. And as you say, as we get
Yeah.
more precise and we as patients are more aware of our data, of our of genomes, there's so many different things that, as you say, as it gets more precise, it gets more efficient. And when it gets more efficient, it gets more sustainable and hopefully bottom line falling into place. And to come back to your point, there's technologies, there's trends, but that training of people is so important, and doing some of the human habits and behaviors that might be ingrained for years with the planet as a priority is a really, really important pillar. Carolyn Millward, thank you so much, CFO at Sheikh Shakhbout Medical City there in our nation's capital.
By 103.8.
Join the conversation.